On this edition of Healthy OC, we'll be talking about the latest innovations in laser eye surgery with John Hovanesian, who is a specialist in refractive surgery with the Harvard Eye Associates. Did I get it all in okay?
Yes, you did. Thank you.
Talk about some of the changes taking place now in eye surgery.
Eye care has changed so dramatically in the past 10 years and even less, even 5 years. There's so much to talk about. We've seen changes in LASIK surgery where it's gone to all laser procedure. We've seen changes in cataract surgery with new lens implants over the past 10 years that have now, they give us an opportunity to correct not just a problem with the eye, but to give a patient new vision so that they can now see for the rest of their life without glasses. So it's a very exciting time.
We have some video, and we're going to take a look and have you explain what we're looking at, if you would, please.
The newest development in cataract surgery is what we're going to talk about, which is the use of lasers. And now to make the incisions that we used to make by hand in cataract surgery, we're using a laser to create these openings in the eye. And this allows us to really engineer them to not only provide a good, safe, self-sealing opening in the eye to allow us to remove a cataract, but also to allow us to adjust the vision as well. They also allow us to treat the lens of the eye to open the front capsule of the lens. The lens is inside the eye, and when we're doing cataract surgery, we remove that lens because it's become cloudy. And so these lasers allow us to create an opening in the capsule, which then a surgeon can complete. So to be sure, there are handmade steps, but the major steps of surgery that require precision, the openings in the eye, the openings in the lens, and even as we see here, fragmenting the lens to soften it so the surgeon can then remove it, are now possible with a laser.
Wow.
And this allows us much less manipulation of the eye's tissues. It allows us easier healing time, and it allows us to be much more predictably know and control what a person's vision will be after surgery.
Wow.
So as you can see that there's still a surgeon involved, and I'm sorry this is a little graphic perhaps for some viewers, but these instruments that you're seeing now are not laser controlled, of course. They're controlled by a surgeon working through a microscope. But with the effort of the laser to soften the lens before we go in, we can then do the treatment, remove the cataract with less trauma.
Now, you mentioned self-sealing. Is that exactly what it sounds like? There's not a stitch, there's nothing, it's just you put it,
That's right.
Put the flap back over.
And in fact, with cataract surgery for a number of years, we've been using self-sealing incisions that were made by a very precisely controlled blade, but it is by the surgeon's hand and working through a microscope. And so we've had self-sealing incisions for some time, but we can't create an incision like you saw in the video that has a configuration that to the micron level of precision we can tell the laser how to make the opening. And that will probably lead to greater safety, fewer infections, which is a rare event now, but will become even more rare, and also to help control vision.
Doctor, what determines what lens you use in cataract surgery?
We do measurements before cataract surgery with a variety of instruments that help us determine what the remaining focusing elements of the eye will be after the cataract, which is the lens of the eye, is removed. And that then tells us what power of a lens to implant in the eye, much as we do with eyeglasses, but of course the formulas are different and a little bit more complicated.
Who's a good candidate?
Anyone who is developing a loss of vision that we can't correct with glasses, who is having some of the classic symptoms of cataract, which usually includes difficulty with reading vision, even with glasses on, loss of nighttime clarity for driving, glare from headlights and so forth. Those are people who we consider good candidates for cataract surgery.
I tell you, it's amazing. After I had mine brought on by medication I was taking for my heart, but it's amazing, and I see now colors that I had not seen in years.
It's a wonderful change. It's a wonderful technology.
Thank you very much. We appreciate it very much.
Thank you.
Joining us.
Thanks,
Thanks so
Doctor.
much.
We appreciate it. All right, still to come on Real Orange.